Richard, so glad that you could be here to talk to me about what you're working on with StartUpHealth.
Pleasure to be here.
So you've developed this device, you've got it right there in your lab, that uses pulse and light to kind of retrain the brain and do some pretty amazing things. So tell us about what this device is.
So basically it uses pulsed light and sound to generate very specific patterns in the brain. And if you think about it as kind of anxiety relief on demand, that means that it has applications in many, many different areas of pain and mental health.
Okay.
Because all pain is a combination of the signal coming in from your body and how your brain is processing that signal. And that's why anxiety, depression, sleep issues all feed into how people perceive and feel pain. And we are solving a very large part of that problem by giving people control over their levels of anxiety in real time, on demand.
So walk me through the patient experience of it. Let's say that I deal with chronic anxiety and I have this. Do I put it on at night, in the middle of the day? How many times? How does therapy work?
So in the clinical trials we've got going on at the moment, the fibromyalgia one is the biggest one. It's a 1,000-person one-arm study. We're asking everyone to use it last thing at night to go to sleep.
Okay.
And during the day whenever any of their symptoms are too much. So if they are too stressed during the day, or they're too fatigued, or too much pain, then they'll stop in the middle of the day, put it on, turn it on, and then they're, through closed eyes, they're seeing pulses of light and hearing pulses of sound that then move them very quickly into a very relaxed state or to sleep.
So I think anyone listening to this would be forgiven to think that light and sound was kind of soft science. You know, in the past, we've sort of sold those sorts of tools, and yet you're working on really clinically validating this in a new way. So how is this really different from previous attempts to use nice sounds and light to sort of relax people?
Basically, when I was originally injured, I had a nerve damage pain problem that was so severe I had a 5-year life expectancy. So when I was trying and testing the first versions, I was an extremely sensitive barometer of what was working and what wasn't, and then I backed that up with EEG.
Okay.
So it was trial and error to do what I needed to do to fix my own pain, and in the process measuring everything I was doing and then tracking and then saying, okay, now let's start testing this on the people. Got 1,000 people's worth of EEGs, and now 5 different clinical studies. And really what it boils down to is, when people think light and sound, it doesn't necessarily conjure up ideas of rigorous science, but if you think about it logically, you're trying to get an informational signal into the brain. You can do it with drugs, and every drug has a particular frequency pattern that it produces in the brain, but you can't do it on one part of the brain better than another. You're putting a drug into your system, it's going through your blood-brain barrier, and it's affecting your whole brain. Or you can do it transcranial magnetic stimulation. You can get a whacking great big magnet in a clinic next to your skull, and then you've got to go back into the clinic every single day to redo that. And the best clinical studies on transcranial magnetic stimulation are showing it works, but only if you're going in almost every day for 30 or 60 days. So really expensive. Or you can do it electrically. You can zap the brain with electricity, but the skull doesn't transmit electricity very well. So it's a very blunt, crude method of doing it. Instead, we're using the brain's own information system, your eyes and your ears, to transmit the exact signals we want to get into the brain in the way the brain wants to actually receive those signals.
And we're not talking about mild pain here. We're talking about folks who are debilitated by chronic pain, right?
Yeah. So we can go after everything from people who've got mild insomnia to people who've got very, very severe levels of either fibromyalgia or neuropathic pain. Those are the 2 clinical studies that are underway right now, because all pain, sleep and lack of sleep and increased anxiety, all pain is made worse by those problems. So it becomes a vicious feedback loop of the less you sleep, the more pain you have, the more pain you have, the less sleep you have. And so this idea that there's really a distinct dividing line between mental health and pain is just wrong. You have peripheral pain signals, and then you have how the brain processes that signal, and that's the bit we're working on. And the credibility bar is as you say, it's there, which is why it becomes much more critical that we get through all of the clinical trials that we're doing.
Yeah. So I know you're in the middle of trials, and so we're still preliminary, but you've gotten this into the hands of people who need it. So is there a patient story that really sticks with you, maybe keeps you going, someone who really was able to benefit from it?
There's been a lot. I mean, fibromyalgia is an all-body pain problem that affects 85% of people who have it are women, and they have 3 licensed drugs available to them. That's it. No other treatments are FDA approved for them. Of those 3, Lyrica is the only one that gets used in any large amount because it's the only one that has benefits that outweigh the side effects for enough people. In our early results, we're helping 4 times as many people for 4 times as long for about the same amount of benefit.
Yeah.
So whereas, like, you know, one in 5 people can tolerate Lyrica, we're at 80% of people tolerating us. Whereas most people finish Lyrica, don't do it for more than 6 months, and by 2 years there's about 10 or 20% of people still taking it. We've got 80% of people still using our device at 2 years.
Yeah.
And now this is still early data. We've done this first 76 people out of a 1,000-person study, and but yeah, so far the results are looking very, very strong. And you sort of touched on this, but there's a big issue here of side effects. I mean, you're dealing with pulses of light and sound that have very few side effects compared to pain medicine. Almost none.
Almost none.
Almost none. Yeah.
And
we just, in terms of, we have a non-significant risk designation by the FDA, so that means we are able to be on market as a wellness device, and at the same time, we're doing these trials to validate the actual specific claims we want to make.
Got it.
But yes, we have a very, very good side effect profile of almost no negative side effects.
Got it. So the initial profile is as a wellness device, and now you're validating future uses.
Yeah, that's correct.
What gets you the most excited about, you know, the potential use cases of this?
So when I first fixed myself, it took me 6 months before I was admitting to myself that, okay, this is really gone.
Wow.
Then the next question was like, who else can we help? And then it really becomes a question of who else is no one else helping, either because they can't or because they can't be bothered. It's given labels like the crazy woman's disease, and those people
Fibromyalgia.
Fibromyalgia. Yeah. So these people get treated by the general medical profession not well, because there are not any good solutions, and therefore they get brushed off. So the average fibromyalgia patient goes through 5 different doctors before they even get a diagnosis.
Wow.
So the people who work on fibromyalgia, who care about it, really care, and they're desperate for more tools. So being able to get tools into the hands of doctors and pain clinicians who really care for their fibromyalgia patients, that's the most exciting bit, because they've got very few other alternatives.
Yeah.
And then after that, a little bit later down the line, PTSD.
Wow.
We've got 8 million vets who have PTSD. The PTSD rate amongst nursing staff in regular hospitals, I've heard of 3 different studies, all of whom are putting that diagnosis rate around 50 to 60% of actual nurses working to keep us all healthy and well.
Wow.
A little bit less on that on doctors, but not a lot less. So COVID has produced so much strain on the healthcare system. So being able to help those people as well, because they're helping so many other people, that's the exciting bit.
Richard, thank you for taking the time with me today. Congratulations on the device, and I just love that you are so passionate about these populations, many of whom really have been neglected or haven't gotten the care that they need. So I wish you all the best.
Appreciate it. Thank you.